Hi, I'm Dr. Ada Latino Feliz, and today we're going to be going over a lumbar self-assessment for low back pain. So as you're going through these movements, if you are having any pain or discomfort, you want to make sure that you're being assessed by a doctor of physical therapy. You can reach out to us if you have any particular questions, but this is what I do typically with my patients or my athletes if they're having any issues and we want to rule out anything going on with the low back. So the first thing we want to do is keep the feet together, and I'm going to show you from the side. And you're going to try to reach down, and ideally you should be able to touch your toes. You want to keep the knees nice and straight, work your way down, and if you're able to, touch your toes. Sometimes if the back is uncomfortable, you'll see people doing this, or maybe this is as far as you can go. So again, ideally the goal is to be able to reach down, keep your knees straight, touch those toes. Next, going into extension. I'm going to have you put your hands on your low back and engage your glutes. So you're going to squeeze here, and then if you're able to, go ahead and push the hips forward and lean it back. And then come back to the center. And again, you'll do that again. Squeeze your glutes. If you're able to, go ahead and bring it back, and that should ideally be pain-free. The next movement we're going to do is going to be rotation. So you're going to have your feet about, feet together. And ideally you want to do this in front of a mirror. So if I have a mirror, I'm going to rotate as far as I can, and you should be able to see my opposite shoulder. And then I'll go towards the left, and you'll see here is actually a bit limited for me. So much easier for me. Now this doesn't hurt, it's just stiff. And I actually have a history of low back pain. And when I was 16, I actually had a stress fracture in my back from running. So that's a maladaptation that has occurred over time, but my back is not painful. So just wanted to give you some, an assessment tool so that you can actually screen your back and see how you're feeling. All right, so we're gonna be going over 5 exercises that I like to use in the initial stages of having low back pain to help minimize discomfort and to improve mobility in your lower back. The first exercise is going to be a 90-90 abdominal breathing. So when you're doing this, you want to make sure that as you take a deep breath, your abdomen expands out and to the side. So you want to think of almost like a cylinder or just kind of like a ball, and you're breathing into all areas, including the front and the back of your abdomen and then the sides. You'll inhale, and then on the exhale, you want to breathe out through the mouth as if you're breathing out through a straw. Exhale fully until you feel tension in your core. The more you're able to relax and breathe, typically this helps calm the nervous system, and it actually does decrease the intensity of your pain. So it's going to look like this. You can prop your legs up 90-90. I like placing a ball or a pillow or a towel in between your legs, and you'll take a deep breath, inhale, expanding the abdomen, and then as you exhale, pressing the ribs down. You can squeeze the ball, or squeezing if you have a pillow in between your legs. Again, inhaling, allow the abdomen to expand, exhale fully. And as you're doing this, you want to make sure that you're doing it in a pain-free range, meaning this should not be painful. And try to relax the neck as you're doing it as well. And that's your first exercise to decrease low back pain and improve mobility. All right, so the next exercise is going to be a pelvic tilt. We're going to add the abdominal bracing that we did from the first exercise, and we're just going to add that pelvic tilt to it. So you're going to lie on your back. Your feet are going to be about hip width apart. Place the ball in between your legs. Hands can go on the abdomen as well. You'll take a deep breath. As you inhale, expand the abdomen. And as you exhale, press those ribs down, and you want to push your low back into the ground and tuck that pelvis under while you're squeezing the ball. So a lot of moving parts here. Again, inhale. You can arch your back a little bit, push that low back into the ground, squeeze your ball. And you'll repeat this for about 10 repetitions. So let's say as you're doing this, it hurts or is uncomfortable for you to arch. You don't have to create that space. You can just start from a neutral spine and just again, exhale, tilt the pelvis. You can engage the glutes, engage your pelvic floor, and then relax. All right, so the next exercise we're going to do are going to be lumbar trunk rotations. So this is going to be specifically to improve lumbar range of motion in the rotation. So when we did those rotations in that plane. So you'll lie on the back and keep your feet about hip width apart. So arms are going to be out to the side, and then you're going to allow your knees to sway from one side to the next. So sometimes when the low back is painful, you'll find that you're able to either go a little bit more further on one side, and let's just pretend that I'm in pain here and then I'm a little limited right there. So I want to find where that pain point is, but don't hit the pain point. You want to go shy of it. So I'm going to go shy of that, and then over here this is not painful, so I can go all the way, and then eventually just work your way down until you're able to do this without having pain on either side. And again, I'll dose this anywhere between 10 repetitions or 2 to 3 sets of 10. Normal being able to bring the legs all the way over to one side and then all the way over to the other side, matching your breath with the motion. So inhaling on the way down and then exhale to pull it in. And those are your lumbar trunk rotations. All right, so the next exercise is going to be a cat-cow. So you're going to be on your hands and knees, and what we're going to do here, we're going to arch the back and really kind of go into what's called lumbar extension and lumbar flexion with ourselves in a quadruped position. So hands are going to be underneath your shoulders and knees are going to be underneath your hips. So as you inhale, you want to go ahead and arch your back, look straight ahead, and then on the exhale, push your hands into the ground, tucking the tailbone under, and then reaching your back up to the ceiling and bringing the chin to the chest. So inhale, arching the back, looking up, and then exhale, tucking the tailbone under, bringing the chin to the chest, inhaling flat back. And you'll do this for about either 5 breaths or 10 repetitions. So the 5th and final exercise is going to be a lumbar prone press-ups. So what you're going to do here is basically extend your spine. So you want to make sure that you're careful with this particular movement. Your hands are going to be underneath your shoulders and you're going to be lying on your stomach. So first you want to make sure that you're able to even assume this position, and if this hurts, then likely this exercise may not necessarily be for you. So start over here, hands underneath your shoulders. You want to go ahead and gently press into your hands, bringing the back up into an extended position and then bringing it down. So this should be done in a pain-free range, meaning this is not painful when you're doing it. If you are having discomfort, and let's say this is about as high as you can go, I recommend just going a little shy of that and then bringing it down, okay? So you don't want to go into the pain point. If you're feeling okay and this does not hurt, then you can go ahead and try to straighten out your arms, working your way up. Sometimes you'll find that it's just a little stiff, and then as it gets better, you're going to be able to extend your arms, keeping the shoulders down and away from your ears. Inhale on the way down, exhale, press. And in terms of dosing, I'll typically do anywhere between 2 to 5 repetitions to start, and you can increase that either 2 to 3 sets of 10. So those are the 5 exercises that typically I recommend when patients come in with an acute low back issue. Again, remember that specifically if you want something tailored to you, these are just general exercises, but you do want to make sure that you consult with a physical therapist or your doctor before you start any program, or feel free to reach out to us and let us know if there's anything that we can do specifically for you. Thanks for watching.